And Singapore is midway through its COVID-19 circuit breaker, but experts say cases in the community have not dropped to satisfactory levels. Gwyneth Teo has been speaking to two doctors who think it's possible the circuit breaker could be extended for another 2 weeks.
What do both of you think about the numbers that we've been seeing over the past week and past 2 weeks of the circuit breaker measures, and what do those numbers indicate to you? Perhaps Dr. Leong, you'd like to start?
We're certainly seeing a fall in numbers, but I must say I am rather disappointed. I expected the numbers to continue to fall, but it seems to have stagnated at about 25 to 30 cases a day. I will want the numbers to fall at this point in time to less than 10 to 15, and towards the fall for May, less than 5. That would tell me certainly that circuit breaker efforts were very, very effective.
But beyond the numbers, it is also important to highlight that we need to know where these cases are coming from. We still have evidence that the disease is spreading in the community. And even after exhaustive contact tracing, we are still not at a situation where we can confidently say we have very few unlinked cases. The vast majority of Singaporeans are keeping to the call, the rules that the government has set in place for us. They are staying at home. But there is still a small minority of the people that are out there. Perhaps some of them are in essential services. Some of them are just breaking the rules.
Could it be that it's the vectors are actually people who are performing essential services? And in that case, then would it not be wise to have a almost total lockdown in that sense and keep everybody at home?
We have seen that now McDonald's across the island have shut until the end of the circuit breaker. We have seen that the construction sector has also been closed down, and all the construction workers are now required to stay home for 14 days. To me, these are indication that actually the data that the government is receiving daily is pointing to it is entirely possible. It is the fact that some of the current infection are the results of essential services workers.
Even if someone in front of me is infectious, I can protect myself by wearing a surgical mask, or if a cloth mask has been issued to you. Because I know that I work with COVID patients and I have not been infected. The mask actually works. So do not blame it purely on the other people. If you have fallen sick with COVID, I'm going to ask you, were you out when you're not supposed to be? Were you wearing a mask consistently throughout? Because if you did all this together with the physical distancing, there's no reason why you should fall sick.
This is really where individuals have to play a part, because the government has put in place rules that already try to maximize the ability to contain this with the need to keep certain sectors of the economy going, to keep certain functions in the country going. Unless we want to reach a stage that because a small fraction of us are just not keeping to the rules, that the whole society now needs to be punished with even more stringent lockdown measures. Otherwise, I think keep to the current measures and we should see the signs improve with time.